I'm here with Jeff Oldham, founder at Informed Consulting, Sharon Bryan, a partner at Informed Consulting, and Anna Torchio at Informed Consulting. Welcome, everybody.
Thanks, Michael.
You guys are working with, point solution providers, some of these innovative solutions, these new digital health solutions. So what are some of the key challenges those solutions face when trying to find their way into the employer offerings?
Yeah, there's a handful of them. One is, you have a lot of first-time CEOs and entrepreneurs that establish these digital health companies. I have found the majority of time because something happened to themselves or their family members that they're looking to remedy or improve upon. But they haven't worked in the healthcare industry, and so they may not understand that there are a handful of very significant nuances that they need to be aware of. The first of which is, interestingly enough, in the self-insured, large employer world, I would say the market is actually B2B2C. And what I mean by that is, if you're a digital health company and you're selling to a health plan, or you're selling to an employer, or you're selling to a government entity or what have you, that first sale, that contractual sale, is great, but you can't start, high-fiving or chest bumping until you get your product into the actual members' hands. And so I think one of the things that a lot of folks don't recognize is that, yes, of course, your product has to be terrific. It can drive ROI, can help justify, the investment. But your ability to figure out engagement and how to get your product in front of the member is crucial. I think most folks just sort of paint with a broad brush and they make the assumption of, oh, the employer can do that, right? The employer has great relationships with, all thousands of their employees. And, needless to say, unfortunately, when the economy is having its challenges, HR and benefits teams are typically the first teams to reduce staff. And so the idea that the employer can just sort of, wave a magic wand and create all this communication, it's incredibly important for these B2B companies to actually even have like a B2C skill set around when you're selling to an individual consumer. You need to have an omni-channel approach of finding them and getting the word out and making sure that your product is sent to them. I would say just a couple of other things. One is, the first-time entrepreneurs that we work with, I think a lot of them certainly have studied in, MBA school, the majority of them, around sort of the financials of establishing a company. But to me, I would say, like they've learned the math and the science of it. But I would say the arts and humanities piece of a company around how you interact with your employees, how do you manage them, how do you pick people, both investors and your first few hires, that can actually help you in opening doors. When you select people that don't work out, how can you pull folks aside? I find that these are challenges that most entrepreneurs, first-time entrepreneurs, will think, well, if I build a good product, that's all I need. The market will come and everything will take care of itself. And I would just say, no, you've still got to go to the market. And then secondarily, you still have to invest in, non-mathematical items to ensure that your team is performing. And then lastly, I would say the biggest challenge that we find is for first-time entrepreneurs is they've got a product, they've got a great idea, and they need funding. And so they go to the market and raise capital, and they don't question a lot around relative to what are the backgrounds and the experience of the people that are willing to help invest in my company. And in case you're asking, well, why does that matter? Healthcare is, I don't think anyone would argue, if not the complex, one of the most complex industries. And so taking investments from people that have sort of been there, done that, have either, you know, lived as executives in health plans or for large employers, or, you know, perhaps worked for VC firms that specialize in healthcare related distribution. That's so important that those are the people, uh, as much as possible, that you partner with them on the investment side, because they can tell you a lot of the things that the textbooks won't tell you, around how to navigate through the industry. And then lastly, I would say, when you when entrepreneurs sort of grab the first investors they can and they don't have the background, then there's a lot of challenges relative to timing and expectations. So, you know, if someone has never sold B2B2C and you've created a product for a health plan, um, then an investor may have expectations of, well, geez, you know, you should be able to, you know, start selling and obtaining revenue in 90 days, 120 days. That seems very reasonable. Um, and so you inadvertently have conflict with entrepreneurs and with their investors, because they have inadvertent unrealistic expectations. And of course, that puts additional stress on the entrepreneur. And needless to say, an entrepreneur is spinning numerous plates at one time, and they need clarity at all times. So anything that to me would take away from their clarity certainly would hurt.
Everything that Jeff said, I completely agree with. I think the one other piece on, we've worked with, a number of startups at this point, and it's been really interesting to see how some of the boards and the advisors have lots of contacts because they come from this industry. So I would say, as you're, if you're a founder looking for investors and board members that really can help you strategically distribute and communicate your product to the market, is a huge value add, in and outside of their investment. And then on the other side is, we've seen, I think it's probably typical that these founders get information and ideas from everyone on how to distribute their product. And so we've oftentimes seen where people have a good idea, but just don't stick with it long enough. So really deciding on what you're going to do, what you're going to try, and making sure that you give it enough time to be successful, because this enterprise space is complex, and it does take time for people to do it successfully. I think we often see in the headlines the people that have hit it big, but we don't ever really pay attention to the years they spent kind of building that process underground.
A lot of what we see is the development of a solution that is great for anybody. I mean, anybody would love to have a virtual dermatologist or access to telemedicine across any of their healthcare needs, which is great. But when you think about who you're initially selling to, which is the employer total rewards team, those bin admins, these entrepreneurs don't necessarily have the experience or the insight into what their day-to-day is like. What is their life like every day? What are they thinking about? What are you selling to them? Is what you're selling going to put a lot of work on their shoulders? Do you have ROI data so they don't have to come up with it on their own? How are you going to disseminate it to their employees? Is it in a channel that is existing today? Do they even have email addresses on file? What are the impacts from a data integration perspective? All of these things this is how the employer buyers are thinking. And I think the entrepreneurs don't necessarily have access into what they are really assessing, and all of the minute details that go into to them being able to approve and then pitching it to their leadership to also approve, from a security, budget, legal perspective, moving forward. So I would definitely encourage entrepreneurs in this space to take the time to maybe interview some total rewards professionals or bin admins, and really put yourself in their shoes, and that'll help you be a much stronger seller in this space.